Welcome back. Now, as we had discussed in that first segment, a video recovered from the mobile phone of a Palestinian medic who was killed by the Israeli occupation forces shows clearly to deny the claims of the IOF that these medics had acted on behalf of Hamas. It clearly shows that when they were on their way just to do their jobs, they were shot, killed, and murdered at that very same time. And this, of course, has sparked more outrage amongst the medical fraternity from an international perspective. But this is not new to many of the Palestinian medics. Hospitals have been bombed, and the very same medics who are trying to just do their job to get to the injured and destitute of Gaza seem to be having a difficult time. I'd like to welcome from Cairo, Egypt, Dr. Omar Al Najjar, who is a medical professional who was originally from Gaza, but is now residing in the Egyptian capital. Dr. Al Najjar, assalamu alaikum wa rahmatullahi wa barakatuh, and shukran so much for making the time for us.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Thank you for hosting me.
No, it's an absolute pleasure. I think, Dr. Al Najjar, to even speak about what happened on Friday night, I think as a medical professional yourself, there is a whole range of emotions that you are going through right now. But let's look at this genocide as a whole. The difficulty that Palestinian medical professionals, I beg your pardon, have had to endure during this time. It's something beyond words, isn't it, given that they're not only having to help the injured, but they're also facing the possibility of bombs being dropped at that very same hospital.
Yes, exactly. Let me firstly comment on this horrific event. This is a fully fledged crime documented with both audio and video evidence. And the Israel occupation army has changed its narrative more than 3 times so far, all of which are disproved by the latest widely circulated video. There were in a full official uniform, something we as doctors in Gaza have been used to. Just 2 hours ago from this moment, our colleague Dr. Mahmoud Abu Amsha was martyred in Gaza City after a strike on Salah ad-Din school. With this, the number of death worker martyrs has exceeded 1,000 of healthcare workers have exceeded 1,187 healthcare workers, in addition to more than 137 detained, and also 25 are missing. So it's very horrific situation. Unfortunately, we are getting too used to it in Gaza, and all of the world is watching this and watching this genocide, podcasting lives and social media. There are so many struggles. We are as a healthcare workers in Gaza. I worked in Gaza 7 months in this genocide. And it's a very bad situation, and we do not practice like the ethical, the guidelines, medical interventions. We all trying to save life by the equipment that exists, and despite all these things, we are getting directly targeted by this army.
Dr. Al Najjar, I want to go to what happened on Friday night, because when you look at it, and you look at it carefully, you've hit the nail on the head. This is a crime, because not only they are marked, number one, and number two, they are clearly saying, listen, we're medics, we're trying to get to our hospital. But it's clear that the Israeli occupation force soldiers at that time could not really care. Their main intention, their modus operandi, was to kill anything that they see. And this has been reverberated since the start of this genocide, that anyone who is a Palestinian is a target to them. And I know that it comes across as some sort of humor that, everyone is seen as a Hamas combatant. But really, when you look at it, the sad reality is that there's an impunity that is happening at this moment, and is happening at a scale that no one can really do anything about it because Israel just acts on its own.
Yes. Uh, yeah, actually, it's very bad. This is like a part of a plan. And let me add, one of those paramedics who were killed in this event is someone I know very well. His name is Muhammad Bahlul. He was working with me at the Kuwaiti hospital in Rafah. He was incredibly kind and hardworking, you know. And unfortunately, he's yeah. I think from my point of view, they of course they meant to do this because Muhammad and all other colleagues were incredibly active. And for me, I witnessed Muhammad so many times residing. He hardly slept and was always on alert, waiting for referrals, waiting for the rescue calls. He will not hesitate to go directly to any place wearing his helmet, wearing his official clothes to go directly and to rescue the people. So this is the plan. Yani they mean to reach and to kill the people who are serving and helping other peoples. And this is an evidence in the medical sector as well in any other social or charity work in Gaza. We know and we saw how they killed and taken captive Dr. Many of other colleagues. One of them are Dr. Hussam Abu Safiya. He was the head of an Indonesia hospital, and they took them until now more than 4 or 3 months until now. So it is like a part of a plan. They want to kill the people directly through the airstrikes, through the killings, and through the shelling, and also indirectly by preventing any kind of help to those people in Gaza. Even yesterday night, they targeted a tent inside Nasser Medical Complex itself. And 1 week or 10 days ago, they targeted the surgery department in Nasser Medical Complex. And I can't count the large number of healthcare attacks that is documented by the international organization, by the WHO, and all the people around the world. The world is witnessing this is happening in all aspects of life.
Dr. Al Najjar, when we see it, and I don't think it's in any means necessary for us to downplay how much we, as the world, are witnessing this genocide live on our phones, on our screens, whichever way you want to see it. It has been witnessed live. We are now seeing these medical facilities targeted, a cancer hospital in Gaza blown up, a hospital in the enclave which is dedicated to special needs being targeted. How much frustration, and you would tell, Dr. Al Najjar, being somebody from Gaza, how much of a frustration is there that the world, especially the West, folds its arms and allows us to become the norm, which started on October the 7th, 2023.
Actually, mentioning this Sadaqa Hospital, the hospital for cancer people or patients in Gaza, I was trained there in the Sadaqa Hospital, and also my medical school was which I graduated from is next to it, which is the Medical School of Islamic University of Gaza. And for me personally, I've experienced how important this hospital is for the cancer patients across Gaza Strip. So since 7th of October, as I said before, they are trying to get rid of all the health sector in Gaza to prevent anyone to provide any types of help to people, even if the equipment inside Gaza is very very shortage at this period. So all of us as a medical, as a part of healthcare sector from Gaza are we are calling the international community, we are calling the healthcare worker around the world. They are our colleagues in Europe, in US, everywhere, even in South Africa. They are our colleagues. We did the same oath. We dedicated our lives to help the people, and now our colleagues and everyone in the world are witnessing this happening this happening live, yani, and broadcasting live. So I can't. Yani, since 7th of October, I've been in so many press release and also TV interviews, radio interviews. But unfortunately, as a person from Gaza, we started to lose the hope from the international community. We are in 2025. We are not in 90s or in 50s where these things are happening hidden and no one witnessing it. So for me and many and when I'm talking and chatting with my colleagues in hospitals in Gaza right now, they are experiencing this to me. We've lost the hope from the international community, which is their responsibility to stop all of this from happening, their responsibility to force Israel to stop this genocide. So Israel is targeting and attacking everyone without any limitation, without taking any calls from anyone from the world, like in reality. So I think there are so much like acts and works to do from the international community. It's not an excuse for them to say we've called for a ceasefire or something. For me and for all my colleagues in Gaza, as long as there's no ceasefire, so they are not doing enough to stop this genocide.
Dr. Al Najjar, thank you so much. Shukran for joining us here on News in Focus on Hilaal TV. Much appreciated. Assalamu alaikum wa rahmatullahi wa barakatuh.
Salam. Thank you very much.
That's Dr. Omar Al Najjar, a medical doctor from Gaza who's currently based in Cairo, Egypt. And of course, I beg your pardon, my vision mixer director, Opayame, has just shown you images of the march that took place in the United States of America. That's where our next interview will go. I'll be speaking to a very familiar face here on Hilaal TV, Muna Tare, who's based in Detroit, Michigan. She was one of the keynote speakers of that march. We're going to be chatting to her about how this march unfolded and the reception that occurred across the United States. Do stay tuned.